A few months ago, a parent called me in a panic. A small ER visit, a paid copay, and then a bill for a 3-day inpatient stay showed up, dated the day after their child left the hospital. Thousands of dollars. Their voice? Definitely tense. We pulled the paperwork and found a date error and a duplicate facility charge. Problem fixed, money saved, stress eased. You can almost feel that parent's panic, right? That's the reality. The numbers on a page can look final and scary, but often they're negotiable or just plain wrong.
Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is where healthcare, law, and real life intersect. Each episode, I break down complicated medical and legal topics clearly and practically, without the fear and misinformation. Today, I want to make your next bill feel a lot less scary.
Before we dig in, grab the documents you usually get, the bill or invoice, the insurer's EOB, and an itemized statement if you can get it. Keep a pen and a quick notes page. Those few things are the tools you'll use to catch most errors.
Let's start by sorting who's who on a bill. Hospitals and clinics send facility bills. Those cover the room, equipment, and facility fees. Individual clinicians, like doctors or anesthesiologists, often send separate provider bills. Your insurer sends an explanation of benefits, the EOB, which shows how the claim was processed. When those three documents don't match, that's where errors hide.
Quick note, an EOB is not a bill. It's the insurer's record of payment and processing. The invoice from the hospital or clinic is what they are asking you to pay. If you only get a single total without an itemized list, call and request the itemized bill. Answers live in the line items. When you open an EOB or itemized bill, look at three things first. Is the patient name and date of service correct? What was billed? And what amount did the insurer allow?
That allowed amount is important. It's the negotiated rate between provider and insurer. If the billed charge is $2,000 and the insurer allowed $500, you don't automatically owe $2,000. Here's a short numeric example. Billed $2,000, insurer allowed $500, insurer paid $300. Your responsibility before deductible would be $200 plus any deductible or copay. Simple math like that quickly shows where the real obligation sits.
Now, about those mysterious codes. ICD codes describe a diagnosis, what was treated. CPT codes describe what was done, procedures, imaging, tests. You don't need to memorize them, but skim them. If you had a simple clinic visit and the bill lists a surgical CPT, that's a red flag. Duplicate CPTs on the same date, or unbundling, where parts of a single service are billed separately, are common mistakes to watch for. A few quick checks you can run at home. Match the dates and patient name across documents, add up suspicious line items to spot duplicates, and Google a CPT number if something looks unfamiliar. The search usually tells you whether it's a lab, imaging, or surgery. If the same CPT shows twice for the same provider on the same date, ask about it.
A lot of you ask, how do I actually dispute a charge? Here's a short phone opener you can use word for word. Hello, my name is your name. I'm calling about account number for service on date. The service date and billed amount on my statement don't match the insurer's EOB. Can you please pull the itemized charge and confirm the CPT codes and service date?
And here's a copy-paste dispute email you can send right now.
Subject: dispute of bill for patient name, account number, DOS, MM/DM/YYYY. Hello. I am writing to dispute charge code 12345 on the bill received MM/DM/YYYY for X dollars. The insurer's EOB shows this service processed on MM/DM/YYYY and paid by a different payer. Please review and correct the billed date and reissue an itemized statement. Attached, EOB, itemized bill.
Please respond in writing within 30 days. When you call or email, document everything: the person's name, date and time of the call, what they told you, and any reference number. Keep copies of attachments and notes. That paper trail is your best defense if the issue escalates. Timelines matter. Follow the insurer's internal appeals process and keep copies. If the hospital billing office won't fix it, ask to speak to the patient financial services supervisor. If debt collectors call before you finish a dispute, send a written dispute and request verification of the debt. This often pauses collection while it's checked. If a balance truly can't be reversed, don't assume there's no help. Ask about payment plans, sliding scale options, and hospital financial assistance or charity care. Most hospitals have hardship applications. Submit one before a balance goes to collections. Having an application in process often prevents aggressive collection activity. When should you bring in a pro? If a large balance is at stake, if you suspect fraud, or if a claim has been denied repeatedly with no clear reason or cost. If you're unsure, your state consumer protection agency can point to low-cost help. Quick legal/financial reminder. This episode is educational. For complicated or high-dollar disputes, consult a certified billing advocate, financial counselor, or attorney, especially when fraud or threatened collections are involved. Before you put the bill away, do these 3 things. 1. Verify patient name and dates immediately. 2. Ask for an itemized bill and compare it to your EOB line by line. 3. Document every call and use calm, factual scripts to start disputes. Those steps catch the majority of errors and give you real leverage to negotiate. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant. You can learn more or schedule a consultation at afaqbynurseJessconsulting.com. If this episode helped, please subscribe so you don't miss upcoming shows. Send topic questions or billing examples, no personal identifying info, through afaqbynurseJessconsulting.com, and I may address them on a future episode. Until next time, stay informed, stay compassionate, and always put safety first.